On this slide, we see a lateral view of the skeleton. So in bold are the names of the major bones that you definitely need to know. So I'll go ahead and highlight those. And then as far as the regions of the bones that you should know are certainly the sutures, and you should know what bones the sutures divide. So for example, the coronal suture is going to separate the frontal bone from the parietal bone. You should know that the squamous suture, which is found right here, is going to separate the parietal bone from the temporal bone, as well as the lambdoid suture is going to separate the parietal bone from the occipital bone in the back. Other bone markings you should be aware of are the external acoustic meatus, the mastoid process, which was mentioned, styloid process, the mandibular fossa, as well as the zygomatic arch, which is where the zygomatic process is, and the mental foramen, which was previously mentioned. And again, the mental foramen is going to be a hole for an important blood vessel to go through. So we're seeing the same thing on this slide. So let me go ahead and highlight the bones first for you. Parietal bone, temporal bone, occipital bone, mandible, temporal bone, the frontal bone, sphenoid bone, nasal, lacrimal, ethmoid, zygomatic maxilla, and regions that you should know include the sutures, the external acoustic meatus, mastoid process, styloid process, zygomatic process, which is part of the zygomatic arch, mental foramen as well, and the coronal suture. So there's four main sutures, and there's another suture which you can see from the superior view. When we look at an inferior view of the skull, we can see the maxilla, palatine bone, vomer, sphenoid bone, temporal bone as well. And you can see some of the sutures, like the lambdoid suture, for example. There are other important bone markings to know as well, like that the hard palate, for example, is made up of the maxilla and the palatine bones. The specifically the zygomatic arch, zygomatic process, styloid process, mandibular fossa. The mandibular fossa is important because the mandible actually forms the TMJ joint when it forms an articulation with that. The mastoid process here, we can see, as well as the foramen magnum. As you know, a foramen is a hole for a blood vessel or nerve, and in particular, this is the largest foramen that we have, or one of the largest foramens, and it's for the spinal cord. So this is showing the same view, just of a model. So let me go through and highlight some of these bones, the same bones that were in the previous slide. Zygomatic bone, the temporal bone, and then as far as specific regions to know are the hard palate. There's a lot of them that you do not need to know, which is very helpful. Zygomatic arch, the zygomatic process of the temporal bone, styloid process, mandibular fossa, occipital condyle, which is what articulates with the first vertebra, which is called the atlas, the mastoid process, the foramen magnum, and then we can see one other suture here, which is the lambdoid suture. This is showing the names of sutures, a lot of which that we've already talked about. Sutures are specialized joints which are immovable. As you'll be learning in a later chapter, the joints are classified based on the degree of movement that they allow. Some are immovable, some are slightly movable, and some are freely movable. The first suture is called the coronal suture between the frontal bone and the parietal bone. The lambdoid suture is between the occipital bone and the parietal bones. The sagittal suture is between both parietal bones, and the squamous suture is between the temporal bone and the parietal bone. So there's four main sutures to make sure that you know. This table is listing some of the main cranial bones and their selected features. So I'm going to go through and highlight the important ones that I want you to know. So on the frontal bone is the supraorbital foramen. Other features on the frontal bone are not really important to know. On the parietal bone, there aren't any that you specifically need to know. On the temporal bone, you should know the external acoustic meatus, which is where the ear is, the mastoid process, the mandibular fossa, and the styloid process and the zygomatic process. On this next table for the occipital bone, we have the foramen magnum, which is super important where the spinal cord goes through. The occipital condyles, which articulate with the atlas. That's the specific name for the first cervical vertebra. On the sphenoid bone, there's no particular passageways, but you should be able to see the sella turcica, the optic canals, and that would be it. For the ethmoid bone, you should be able to identify the crista galli, the nasal conchae, and the perpendicular plate. So when you make your index cards to study, you can shorten them to only have the specific parts of the slides that I've highlighted. For the facial bones, as we know, there are 14 facial bones. They form the orbital and nasal cavities, support the teeth with those alveolar processes, are attachment sites for muscles of expression and chewing. So some of the features that you should know on the zygomatic bone would be the temporal process which articulates to form the zygomatic arch. You should know the lateral bone. There's no specific parts of it to identify. You should be able to identify the nasal bones, vomer bone, inferior nasal conchae. For other facial bones, for the palatine bone, you should be able to identify the perpendicular plate. For the maxillae, be able to identify the infraorbital foramen, the alveolar process, which houses the teeth. The palatine process helps to form part of the bony palate, and the zygomatic process. For the mandible, you should be able to identify the mandibular foramen and the mental foramen, as well as the alveolar process. Because of the upper teeth and lower teeth, it would make sense that there's alveolar processes on the maxilla as well as on the mandible. Other parts of the mandible to identify would include the head of the mandible.